Let's talk about sexually transmitted infections, aka STIs or STDs. So you've left home and you've just started university. You left your parents for the first time and you're living independently. There's a chance that you might be thinking about having sex. So I'm here to tell you about the facts around STIs, what you can do to keep yourself safe, and the signs and symptoms to look out for if you develop an STI. Last year there were 400,000 cases diagnosed in the UK, which is an increase from the year before. Now there are 6 main STIs: chlamydia, gonorrhea, syphilis, herpes, HIV, and genital warts. How do you know if you have an STI? The symptoms to look out for is if you have pain on passing urine, pain in your lower abdomen, you can have an abnormal discharge that you haven't seen before, you can also have bleeding during intercourse, and for males you can get pains or swelling in the testicles. Most cases, however, are asymptomatic, meaning you might not have any symptoms at all despite having the infection. You have to get tested to determine which STI you might have developed. Now it's important that you don't self-diagnose or try to seek treatments through other methods, as it's only through testing you will find out exactly what STI you have and what treatment that you need. And remember, if you have one STI, it's easier to acquire another STI in the same time period. And one of the reasons this could be is because your immune system has been compromised, so it's easier for viruses to enter the system. How do you prevent getting an STI? So if you're in a new relationship, it's very important to consider using barrier methods such as condoms, especially when you can't determine the risk level of your partner. Now, how does a risk level increase? It's by having a previous STI, having multiple casual partners, or even risk-taking behavior related to sex. So wearing a condom will reduce the risk of you developing many STIs, but not all of them, such as genital herpes are always protected with condoms, as the skin around the pubic area, which is not where the exact genitals are, if they come into contact with you, you can still develop genital herpes. Another thing you can do to reduce the risk of getting an STI is to get tested every year or when you get into a new relationship. One thing to remember is that STIs can often stay dormant, so that you can acquire an STI infection but have no symptoms, and therefore if you went into a relationship in this situation, you would be passing that on to your partner, but they might actually develop symptoms. So how soon after a sexual exposure can you be tested for STIs? It takes a few days for an STI to incubate and develop into an actual infection. Now for some people, your body will be strong enough to fight it off, and for others it will develop into an infection. Now there'll be a table coming up onto the screen which will tell you for each infection how long it takes before you can actually be tested. So for chlamydia, you can see the incubation period is up to 21 days. Most infections, however, you can start testing after 14 days. So remember, if you get tested before this time, it might actually come up negative. So this information is very important for you to know so you can decide when to get tested. So where can you get tests for STIs? If you are asymptomatic, i.e. you don't have symptoms, then there's lots of online tests you can potentially get access to. If you were to Google STI testing at home, depending on your locality, you might be able to order STI testing directly to your accommodation. Do the urine test into the pot and send it back off for your results. If you actually have symptoms, then it's advisable that you seek your local sexual health clinic. Again, you can Google this and you can find the local sexual health clinic to get an appointment. Now in some localities, getting an appointment can be quite difficult, and this is where it's important that you seek care from your GP surgery to get the relevant testing. But please bear in mind, GP surgeries are only equipped to do a testing for a certain amount of sexually transmitted infections, but not all of them. So if your results show you do have an infection, you may be advised to still seek access to the sexual health clinic. When going to a sexual health clinic, they'll do a few things. Firstly, they will do your testing. Secondly, they will do some contact tracing. And what that means is they will ask about your previous, current partner or partners, and then anonymously contact them to let them know that they could have been exposed to a sexually transmitted infection. This will allow the minimized spread of the infection, and also the importance of looking after the general well-being of the population. The other thing to bear in mind is that all consultations done in the sexual health clinic are confidential and is not shared with your GP surgery, something you might find quite valuable. So what are the risks of you not getting treatment? So whether you have symptoms or not, the risks could be that you develop symptoms, your symptoms get worse. So if you're having pain, discharge, discomfort, bleeding, this can get a lot worse. It can even lead to other conditions like pelvic inflammatory disease, which is a deeper infection, chronic pain, and other illnesses associated with this. Long term as well, it can affect things like fertility. It can sometimes reduce your fertility and impact things related around fertility, such as becoming pregnant. If you were pregnant and had an STI, this can also impact your potential baby. When seeking care from a healthcare professional, you don't need to be embarrassed. With deal with this topic every single day, and we have the skills and the ability to make sure that you're felt at ease, at comfort, and dealt with your dignity maintained. So if you have any concerns, make sure you reach out to a healthcare professional, either through a sexual health clinic, your GP surgery, or online testing to get the help that you need. We hope you found this video useful, and if you have done, please do comment below and share with your family and friends. If you want to find out more about anxiety and depression in university, check out one of our recent videos where we give you practical tips on how you can combat this.